Here are the top 7 signs to check at home and know if you have a torn ACL. Number 1 is that you had a pop or a snap in your knee associated with some event, some trauma that happened. Like somebody fell into the side of your knee. This is the right knee, so this would be the outside of the knee. Or you landed funny, you took a bad step, and your knee bent in a way that it wasn't supposed to, is what people will say. Of course, the knee bends just like this, but the motion that hurts the knee, the ACL in the knee, and causes the ACL to become injured is when it bends forward but also inwards, or straight inwards can also cause a problem. If you had a pop or a snap with that, then there's a chance that you can have a torn ACL, but it could have also been something else in the knee that popped. It could have been the joint loosening up, because you pop all over your body, right? Some people pop naturally, easily, like in their spine, in their hands, in their other joints. If you tend to be a person that pops anyway, then it could be that pop in your knee wasn't the ACL, unless you have some of these other signs that I'm going to tell you about. Sign number 2 is swelling right afterwards. If your knee swelled up right at the joint, right where it bends, within an hour after you had any sort of pop, then that's a sign that you potentially hurt your ACL. There's a bunch of other structures in the knee that could swell, but if you have not had any knee problems leading up to this point, then there's a higher possibility that it was your ACL, but it could still be your meniscus. There's other things in there, the fat pad, there's tendons, there's ligaments in the area as well, other ligaments besides the ACL. All of those can be sources of swelling in the knee. If you did have beginnings of pain leading up to this, or you've been suffering from pain off and on, and then you had swelling afterwards, then it's very questionable if it was truly the ACL, because it could have been the other thing that was already bothering you that got flared up now and swelled up. Number 3 is a loss of motion that changed right afterwards. So within an hour, within a day, especially a day afterwards. If you could bend your knee normally just fine, but then you injure it, there's swelling, maybe there was a pop, and then you can't bend it all the way. Especially when there's swelling, you're going to have a loss of motion. Or if you can't straighten it out all the way, then that's associated with an injury from an ACL. Could be a meniscus still, it could be other issues happening in the knee, but you're thinking it could be an ACL. Number 4 is that it's uncomfortable to bear weight. So whenever you're walking, you might feel like you can't confidently stand on that leg. You might even feel like you need to get on crutches, or if you can't bear your weight because the knee just wants to bend right away, then that's a sign that you do have an ACL tear, so just be careful. If you feel like you need a limp, then do get on some crutches, do get a walker, get something to take weight off that leg, because every time you step on it and it wants to bend and it's making you limp, you're putting more tension through that ACL and potentially other injured structures in the knee, and you're not letting it heal. So make sure that you take the right precautions if you find yourself limping. Number 5 is having pain at night. If you injure your knee one day and later that evening it's hurting you at night, it's lingering, then that's a sign that you might have an ACL tear. Now, if this continues to happen each day for days on end, then you probably do have an ACL tear, and you might consider going to go get an MRI to verify this. But pain at night is a common symptom of an ACL tear. It happens in different ways. You might have trouble falling asleep because you can't get comfortable, or you might wake up in the middle of the night because you shift and move around subconsciously at night. You're not awake, and you might put your knee in a position that it's not comfortable for your ACL, and after a while it wakes you up and you have to move your knee, straighten out your knee, and find a comfortable position again. This is not good, because if you lose sleep at night, then you're not healing, because that's when the most healing happens, when your body's asleep. Number 6 is a loose sensation in the knee. So the ACL is one of the main structures that helps to stabilize the knee, meaning it connects the thigh bone to the shin bone and makes sure that as it's moving, it's not flying off of each other. They're not moving in directions they're not supposed to. But if you have a torn ACL, then you're going to have a sensation of when you bend and straighten your knee just like this without stepping on it, it feels off, it feels loose. You might have a clunk or a clicking sound that happens inside as well. It could be meniscus related as well. But if you compare it to your other knee that's not injured, it usually feels stable and normal, but people will say they have a looseness sensation in their knee whenever they're bending their knee if there's an ACL tear. And number 7, this is one of the most common symptoms that tells me that people have an ACL tear, it's buckling, or some people describe it as giving way. So it looks like this. They might stand on it, especially if it's healed and they don't have many issues, but it wasn't too long ago that their ACL was injured. They'll stand on it and then it just buckles like that. Their knee just gives way, not always causing more injury, but they just don't feel secure. They'll just be standing around and the muscles around their leg are affected because of the ACL, and so the muscles just don't support the leg, and you'll have a sudden loss of knee straightening and the knee just bends a bit. And people usually recover just fine. They might hold on to something, but they lose confidence in their knee and being able to stand on their knee and use it for just normal everyday activities. If you have this sensation, then it's a sign that you could have an ACL tear. Now, what I haven't talked about right now in this video is the testing that medical professionals will do on an ACL. I'm talking about like a Lockman's test, an anterior drawer test. There's other tests used, and of course an MRI, which is an image of the inside of the knee without cutting it open, obviously. Those are tests that medical professionals will use, but usually people can't do those at home. So I'm giving you signs to look for to help you figure out what's going on inside your knee. Now, if you do suspect you have an ACL tear, the best thing to do is go see a medical professional to get it properly diagnosed. Now, healing from an ACL tear, there's so many different options for you. I'm a huge proponent of healing naturally versus having surgery, because very often people are recommended to have an ACL surgery, even though we know there's many cases out there, there's even research studies coming out showing that an ACL tear can heal naturally without ever having surgery. But you need to educate yourself about that and figure out what the best solution for you is, and of course talk with your healthcare provider and discuss with them based on the severity of your ACL injury, and pair that with what you're going to go back to, what you want to plan on getting back to doing. But if you want more help from our treatment approach, which is focused on natural healing by fixing the root causes that put too much tension on the ACL, then I invite you to learn more about what we offer by checking out the links in the description. I've got 2 links down there that I want you to see. One is for our program called the ACL Tear Recovery Program. In that program, I've put my comprehensive treatment approach into over 40 videos that help guide you from a recent tear that just happened all the way to getting back to sport activity, and all the steps in between, so that you can definitively know what to do to recover naturally from an ACL tear. But I've also got a bunch of free videos here on YouTube, and they're in a playlist called the ACL Tear Help Playlist. You'll find that link in the description below as well. Hey friends, if you have any questions, drop a comment down here. Let us know. We'd love to get back to our comments. And please share this video with anyone you think needs to see this. Give us a thumbs up, like the video. That helps us get this video out to more people. And please subscribe to our channel and turn on the notification bell so that you don't miss out on any of the helpful videos we post each and every week. Thanks so much for watching, friends. I'll see you in the next video. Bye-bye.